Hi, everybody. It's Dr. Sandy Laura Kramers. Thank you for joining us for the EYE show. We're on episode 38. I can't believe it. Thank you for joining us and for subscribing and for sending it on to friends and family. We really appreciate your dedication and loyalty to us here at Visionary Eye Doctors. I'm one of the surgeons here at Visionary Eye Doctors, so thank you for joining us. Today we're going to talk about my conversation with Dr. Roland Toyos, who is considered the father of intense pulse light for dry eye. He's been doing intense pulse light since 2002. He reported in a paper he published years later, after he had presented his research at multiple meetings, that he had incidentally found that intense pulse light that had been used for rosacea along the eyelids was making the oil of the meibomian gland more liquidy, and you could kind of express it more easily. So he's done multiple videos. He is initially trained as a surgeon, but went into dry eye, what sounds like full time, when I spoke to him a couple of days ago. So the purpose of my conversation was, of course, to invite him to the podcast, and he kindly refused. He had said that he had become crusty over the years because of some arrows hit to his back over different controversies in the dry eye world, things I was oblivious to, really, until speaking to him partly. So he just declined, and we talked a little bit about his protocol and about future research, which was very much appreciated. And of course, I always invite Dr. Toyos to come join us anytime on the podcast, because I know a lot of our listeners would love to hear his side of the dry eye controversy. We had Dr. Maskin in the past, and Dr. Toyos is kind of the other side of this controversy. So what's the controversy? Well, for those of you that don't know, dry eye disease is a multi-billion-dollar problem, and a lot of us are getting dry eyes as we get older, and a lot of young people are getting it even faster because of screen time, and that's not proven causation yet. It's definitely an association. I think it's a causation. It makes total sense. It's a causation for two things, which we've talked about before. The blinking. People don't tend to blink when they're on a screen. And the blue light, which is more controversial than the blinking, but both are probably involved. So now what do? We have these oil glands we can finally image. We've had this technology now for about 8 years. We can show the meibomian glands, and we see them drying up with aging. We see them drying up in young people. We published a paper, my team published a paper last year about using meibography as a potential indicator for excessive screen use, which is its own paper, unrelated to the treatment per se. But what do? So we have two well-known surgeons in this country, Dr. Stephen Maskin and Dr. Roland Toyos. Dr. Maskin is in Tampa, Florida. Dr. Toyos is in Tennessee. And they have this kind of theory about what's the best way to save the meibomian glands. Do we probe, which is where we take a metal kind of instrument, not a needle, but it can feel like a needle, go into every single meibomian gland, break open the scar tissue, and then express, and that will save the glands? Or do we do intense pulse light, where we shine a very bright light along the eyelids? Dr. Toyos only treats the lower lid, and I'll go through his protocol in just a few minutes. And then express. Sometimes he expresses, sometimes he doesn't. His paper says that he does express the oil glands. So which one's better? And then we have a paper that was done without their involvement, without their proprietary or financial interest involvement, that did those two groups separately. One group had just probing, one group just had IPL, and one had them together. And the one that had them together did the best. So I'm in that camp. I think that team that published that paper is correct. Doing it together is the best. Not everybody needs probing, but it works. I think intense pulse light works for the majority of patients. The question now is, we're going to focus on intense pulse light, because I also do think probing does work, and that was the previous podcast in the past with Dr. Maskin. But with intense pulse light, what's the best protocol? So Dr. Toyos published his paper 2002, which showed that he would do basically the following. He would put a lot of gel. He would do his standard intense pulse light procedure with something called the Q4 at the time. Now there's different types of machines out there. Most recently, Luminous has bought into this and is now kind of expanding that business. We'll go into that at the very end. But basically, he would do tragus to tragus. So he would do basically overlapping pulses, usually 7 on the lower, and then 7 on the lower on each side. And then he would apply more gel and do it again, a second pass. And he would not treat the upper lid. He would only use a disposable pad that would be disposed, and then he would express the lid usually with a Q-tip on the inside and his finger on the outside. That was the original publication. And speaking to him a couple of days ago, he has been working on this now for about 20 years. He sees patients 6 days a week. He said himself he's become crusty over the years, which means probably a little bit of a kind of maybe not the most touchy-feely surgeon out there, maybe not his words but mine. So just, that's kind of the situation that can happen with this type of commitment to this type of issue because it's a chronic condition. And so it sounds like his technique is still about the same. He doesn't treat the upper lid. He doesn't use a metal shield. He thinks a metal shield is dangerous for the conjunctiva of the eye. He's had some patients that have had foreign body sensation after the metal contact lens that became an issue. And so he still sticks by his protocol. He has treated some patients, like one patient, let's say, more than 100 times over the last 20 years, so as maintenance over the years without any side effects. He has had 0 cases of uveitis with this protocol, and that's what his basic premise is that intense pulse light alone is the best thing for the meibomian glands. So trying to talk to him a little bit about what is the best protocol and what's the best for our patients going long term. I spoke to him about a patient of ours that has had now more than 20 IPLs, a beautiful woman with very, very prominent eyes, and has now started to have a slight change of the skin color and maybe a little bit of some fat pad thinning. We're not sure. We're trying to figure out if it's there or not. She notices it, of course, because she sees herself in the mirror every day. Her dermatologist said this could be from the intense pulse light, but what are the options? And she, of course, wants to continue with intense pulse light for now. So what is the best protocol? So what my question was for him is if we could do a study where we do his protocol on one side and we do a more conservative protocol where we just do, let's say, maybe 1, 2, 3, and then 4, or 1, 2, that means the treatment of the actual probe of the intense pulse light. It's usually kind of a rectangular probe, because if you're just doing the meibomian glands, and there's a theory that doing this will decrease overall inflammation more, but we don't have good data on that. So if you're talking about a patient that's going to need intense pulse light possibly for 20 to 30 years, and you want to kind of help the skin and potentially the underlying fat and the melanin of the skin not have negative reactions over time, which one will be better over time? Will you get the same effect of doing 7 like this? So the probe looks like a rectangle this size. Let's say this is the rectangle. So he goes like this, right? And the meibomian glands are located here. What if we just did 1, 2? Would that be enough with the expression? Would that be enough? And should we treat the upper lid? So he said that he's done some studies to that effect, but he has not published them. I don't think he's done this study because it wasn't clear that he had done that study, and I asked him to share the data. And I do ask any patient that's a patient of his, please ask him to share his raw data with us. We'd be happy to publish together. I know he's been burned in the past because people didn't maybe necessarily credit him for what he's done, and we definitely owe a lot of gratitude to Dr. Toyos, but we want the data. We want to know what's going to happen to the kids we're now seeing that really do need intense pulse light, but they're young and they might need this for their whole lifetime. So my theory is that if you do 1, 2, or let's say 1, 2, 3, 4, then you're less likely to have problems down the line, and I recommend a lower joules than Dr. Toyos does. So it's one of those things that we don't know what's the right answer. I think the expression is the key component, and I know a lot of doctors and surgeons that do IPL will just do the IPL and won't express the oil glands, which to me makes 0 sense. I think my theory is that this is similar to a cow, milking a cow, or even a breast milk. The more you milk it out, the more the body will produce the substance that it's trying to produce, such in this case the oil. So I think the intense pulse light is very helpful. I do think it definitely decreases inflammation. I think it improves the collagen. I think it opens up the orifice. It liquefies the oil. It allows the oil to come out better. I think that's wonderful. But I think my theory is that focusing on the glands here as opposed to treating the whole face will lead to less issues or concerns of pigment issues in the skin going forward and fat pad changes, which is still theoretical. We don't have proof of that just yet. This is based on one case alone, but it's something that we want to think about. What are the long-term effects? So that's the question we asked about. The second, of course, is the metal contact lens. He was very adamantly against it. He will never use a metal contact lens. He does not treat the upper lid. And in his defense, there's been about 7 cases of uveitis or some type of inflammation in the eye around the world after intense pulse light. Most of them are from dermatologists that were using facial IPL, and then one was trying to remove a little freckle on the eyelid, I believe, and they took out the contact lens or the metal contact lens, and they treated without a metal contact lens. And then there was a kind of photo we'll add in that shows what could happen, which can be devastating if that happens. The case that was reported by Bascom Palmer They traded on top of the eyelid, and there was no metal contact lens, and the light caused a significant disruption of the pigment of the iris, and that led to problems with vision, discomfort from light for many, many weeks, and it could be very, very dangerous. So intense pulse light is not without risks, and I firmly believe you do need a metal contact lens, even if you're treating here, at least shields, but ideally the metal contact lens, because the light can dissipate, and it's been reported before. And we don't know if Dr. Toyos hasn't seen a case because those patients maybe did not go back to Dr. Toyos. They went to go see another doctor, and that maybe was not reported. We don't know. So it's one of those things, same thing for me. The way I do things, if somebody has a complication, I would hope they'd come back to me, but sometimes they might go see another doctor, or that kind of thing can happen in any surgeon's hands. So those are the controversies. But what we need now is ideally a double-blinded, prospective, randomized controlled study. Dr. Toyos, I think, in a way, is kind of deciding, what, this is great. I've been in this for 20 years. Nobody else is having to deal with these patients day in and day out. I don't have time to publish my data. I have the data. Good luck to somebody else. That's the idea I got from the conversation. But we do need his data, and he's a wealth of information. So please, if you do see him, tell him Dr. Kramer's and a bunch of other doctors, of course, would love to help him publish his data, and obviously work with his team to do this double-blinded, prospective, randomized controlled study on intense pulse light alone, probing alone, intense pulse light plus probing versus IPL alone, intense pulse light plus probing on one eye versus, probing alone. So there's all these different combinations in the same patient, which tries to minimize the confounders involved in this type of study and this type of research, and of course trying to remove the financial interest. So a lot of the doctors involved in this do have their financial interest, and they've spent their careers developing their protocol. So it becomes an issue if you get those doctors sometimes involved, because they want their procedure to have no complications and be the best procedure for the patient, because there's a financial interest and they spent their entire career on it. So there's a component of that as well. So that's what we're looking for. So we need somebody out there, ideally, who has no financial interest in this, who wants to find the truth, who has the patience to kind of help discover what the right answer is, and of course having patients that are willing to help us understand what the right answer is. It's not so much for my generation, as I've talked about before. It's for the generation that are now 6 years old that we're seeing that are so devastating. That's who the study is for. So I would just highly encourage everybody to, when you meet one of your dry eye doctors, ask them, are they doing studies? Can you be involved in the study? That's what we're all trying to find, is how can we work together to help this next generation of patients that we're starting to see, partly because of screen time, as we talked about before. So I hope this helped. I will post some information on my blog about this. We'll have more data that you can kind of sink into to understand what intense pulse light is and if it's good for you and when you should have it done. But I hope you found this interesting, and hopefully you'll pass this on. Have a good day. Thank you.